Assessment, decreased rotation, facet joint stuck open. With translation, no movement on same side. When you have clients that come in, they have either nerve pinches where they're having twitches, you know, or when they move, or they just feel kind of like they woke up with a stiff neck and they move and it hurts. This is a great technique for unraveling facet joints to open and close. Anytime you see my thumb like that, that means you're asking the joint to close. So when I release it, you're asking this one to open, the other one to close. So back and forth. You go from all these 2 all the way down to 7, C7. You just kind of go in there. You're not pushing on too hard. It can be very painful in here, especially if they're really stuck. So you're going back and forth all the way down. So then when you find one that's that feels like it's not moving, you just kind of put sustained pressure against it and side bend the head right into the thumb. And you just hold it. 1, 2, 3, 4, 5. This is another one that you can use to help do this. You kind of take your fingers and put it on each side of the SCM here, and the facet joint, you're right on the facet joints down here. So you just kind of go back and forth. Your translation, the head should just move in this plane here. It shouldn't move like that or like this. You just kind of move it side to side.